Can I just put it like that?
Yeah, that's fine.
All right, thanks. Let me know when you're ready. State Patrol was down here in your parking lot.
Really?
I think they stopped somebody for speeding.
Oh, probably up here on Miller.
Well, it was State Patrol, so it must have been off of Business 40, and then they, I don't know.
I'm ready to go.
You ready? All right, let's go ahead and get started. You guys all ready?
Yes.
All right, here we go. Good morning, Chris Hall, Wake Forest Baptist Health, Infectious Diseases. So it's the 6th of August. A little bit of summer left, and we'll talk a little bit about that in a minute and what that might mean. So we're going to do a little bit of an update, just a few things that I have marked down that may be of interest, and then we'll spend some time answering questions. People liked how we did that last week, and so we solicited and had people send in some questions again this week, which we can approach. So where are we sitting here as far as our numbers in our area, our region, and the state, and across the country? Well, here in North Carolina, since the 18th of July, our case numbers have been slowly declining, and that's really with consistent, if not a little bit, of increased testing. And so it's modest but persistent. Now, for those of you who are avid watchers and followers of the state dashboard and our numbers, I confess I am, but I'm supposed to be. That's part of my job. The last 3 days seem exceptionally good. When you're an epidemiologist or a scientist and you see a slow but steady decline, and all of a sudden it does this, and you don't really expect that, then what one should ask is if the data's all been recorded correctly. And so we're looking into that, I think, at the level of the state. And while it may seem like good news, I'm not, it doesn't worry me. We see this when we do research in epidemiology. But it also seems to be something that happened all across the country all at the same time. And if you remember, we talked about it a couple weeks ago, but around the 10th to the 14th of July, we changed how we do our case reporting. Whereas it used to go through the CDC and then through to the states, now it abruptly changed to go directly to the federal government, to DHHS, and so it's a new data system. And that might have something to do with it. And so, anyway, when you look at the numbers, just keep that in mind, that there may be some correction to that coming in the next few days. But I think overall, for us in North Carolina, it is true that our case numbers have been going down since the mid-July. Now, why would we have had this little peak or a mini surge in the middle of July? Well, it was about 10 days following the 4th of July, and which is about when you would anticipate seeing numbers increase because of an event. And we saw that with Memorial Day, and I expect we'll have a bump in cases also associated with Labor Day. And we'll talk about what we can do to keep that from happening. Hospitalizations across the state, stable, a little bit down, actually over the last week or so. And then here in the Triad also, our hospitalizations numbers are down. I know of no areas in the state that's having problem with hospital capacity or ICU capacity, and including here in our Triad area. So on an even keel, maybe improving a little bit, and that's encouraging. So one of the things, though, is that there's been across the country a little bit of a shift. If you remember, we had the big 5 states: California, Arizona, Florida, Texas, and depending on the day of the week, South Carolina, Alabama, or Mississippi, has problems. The numbers in those states have at least plateaued, if not come down some, still at a fairly high level, though. And there are still problems in those states with ICU capacity and hospital capacity, although it has eased off somewhat in the last couple weeks. If you remember, we talked about those are the states that opened early and fairly robustly as far as their entire economy at one time. And since they've walked back those a little bit, and a lot of those places have put in mask mandates either at the state level or locally, and that's probably all of that's probably accounted some for them being able to plateau and level off some. Though in the last week we've seen that there have been more cases and a push where the problems, the states that are going to have problems next to a shift. Many of these are in the Midwest, including Kansas, Nebraska, to some extent Iowa. And then some of the cities that had problems back in April are starting to see an increase in cases again. So, you know, things kind of shift and they move around. It's kind of like if you get a big old water balloon, which is kind of fun to have in the summertime, and you squeeze one part of it and it balloons up in another, squeeze that part and it balloons up in another. And so, you know, I think this is just going to be the way it's going to be for a while, until the whole country on a whole kind of gets on an even keel with acceptance of masking and limiting large gatherings, and then encouraging personal distancing and encouraging businesses to curtail or close that are problems, where there's a lot of people who get together in close proximity, and where viral particles can be exchanged readily, so bars, small fitness centers, so on and so forth. So as time goes on, we'll see if the country kind of finds its own even keel on its own. There's also been an increase in cases again in some of the countries in Europe that had a lot of success in flattening and pushing down the curve, Germany, Spain, and we have to kind of keep an eye on that. One thing that Europe did is when they went into lockdown mode, they locked down, and they were pretty effective in getting their curves pushed down. In a lot of Europe, just frankly, their public health systems are a little bit more organized and resourced than here in the United States. So when they released their lockdowns and started to open up their economies, public health kind of stepped in to do testing, identification, contact tracing. And so when you get everything pushed down, it's a lot easier to control things than it is if you have a high number. So, you know, I think Europe will be okay with all of this. If you wanted to go to Europe to explore it, you're going to have to find a way to do it, because most of these places won't let U.S. citizens in right now. And if they do, you're going to be in a 14-day quarantine, or you're going to have to show a test within 72 hours that's negative. So travel's still tough. Just a bit of an appeal yet, and I brought this up every week, and so you must know that Dr. Ohl thinks this is important. You know, while we're in vacation season, you need to think a little bit about, especially extended family and friend vacations, remember that your household is a bubble, and your brother-in-law's household out in West Virginia is a bubble, and if you all get in together in one beach house, your two bubbles have fused. And so if they have been exposed somewhere, and you're now together, everyone's exposed. And this has been a way that I think a lot of our clusters have been occurring throughout the summer. I've heard about so many vacation-related clusters. And so, well, I'm not saying don't get together with family or friends, but when you do it, You know, try to keep outside. It's a little cooler now, it's a little easier. Personally distance, and unless you really have a high degree of reliability in what people have been doing and where, you know, even consider masking when you're sitting around watching Netflix together after a long day at the beach. So, particularly younger people is where we're seeing a lot of cases popping up, and so the 20 to 30-year-old age group. So while we're talking about the 20 to 30-year-old age group, you know, it hit the news yesterday that that the Orange County Public Health Commissioner was encouraging Chapel Hill to go all virtual. Just personally, it may have been a little bit late since most of the students moved into the dorms this week. So, you know, colleges are going to be something to watch in the next month, and a lot of universities are kind of still sorting out what they're going to do, and how many students they want to bring back, how they're going to work with testing, what they're going to ask their students to do. And not all universities are the same. Smaller universities are going to have it a little bit easier than bigger universities. And if you've been to Chapel Hill and you understand the university culture there, you can understand why the Orange County Commissioner or the Health Commissioner was worried. Is because you know, people tend to get together and enjoy each other in bars and restaurants and having social activities, parties, and so on and so forth. So I think that was the concern there. So we'll see what locally here, how Wake Forest University is going to do it. I think right now plans is to have everyone back, but I know that they've been doing a lot of planning to do so safely. Regarding schools, a lot in the news this week about public schools and having students back versus going virtual, and it seems to be all over the place. My personal opinion and about reading the media this week is there's a little bit too much attention on individual cases and things that may be occurring in individual school systems. And it kind of gets, sometimes the whole entire perspective gets lost. So if you have a student who tests positive in a school, it's a student who tested positive. It doesn't mean that the school is contaminated, the school is full of contagion. It just means somebody was positive there. And frankly, over the entire summer, this has been going on in our workplaces. In fact, I would imagine just about any workplace that's of considerable size has probably had a case or two because people get exposed, mostly on the outside. There haven't been that many workplace-related ones. And so, you know, this is going to happen, and it's okay, and schools can still move forward. It doesn't mean there's a big outbreak. Here in North Carolina, if you look at daycares and schools since the beginning of the outbreak, there's been 14 clusters, 13, something like that, in daycare centers, only one in a school. The one in a school was a small cluster in staff members, actually, not in students, and most of the daycare ones have also been in staff. So it seems to be it's this, when it happens, it's staff members, and not so much the children that are driving it, these clusters. So actually, when you think about it, with the number of daycare centers that have been open throughout the entire last 6 months, it's a fairly small number where these clusters have occurred, and they're all small. So I think that's kind of encouraging. Summer camps have been going on throughout the entire summer throughout the state. Most of these are day camps, including here in the Triad region, and we've really not had any trouble with those. In fact, I know of no cases here in the Triad region related to that in day camps. So I think schools are probably going to be okay right now. I think the media may be a little bit focused on it, and after Labor Day, they'll probably move on to something else, like football. So will we have a football season this fall? I still think it's going to be tough to pull off. I'm not going to spend a lot of time talking about this morning, but putting 20,000 people in a stadium just doesn't seem smart right now, even if they're masked. And high school football is a big, huge social event, and if the public school's not open, but they still want to have sports, it seems a little odd to me. If you're not going to have your education, then is sports really a good idea? And I'll just put that out there. I wanted to just wrap up my comments with a little bit of a perspective. It kind of seems to me that, with the media and with, the questions I get and briefings I do and people I talk to, that things seem a little polar. So you either have a bunch of people who are scared to death and are thinking that the virus is going to sneak out behind a tree and grab them, or that being at work simply is going to be the end of their life, exaggerating some. But and then you have a group of people who just don't seem to care about it at all. And I think we need a little bit more of a measured in-the-middle response. It's because it's not either of these things. Yes, I mean, we are in the middle of a pandemic. Yes, transmission's occurring, and yes, it can be serious. And so we want to do everything we can to not get sick. Who wants to get sick anyway? So and the things that we can do to prevent it are just so easy and fundamental: masking, personal distancing, avoiding large groups of people, and frequent hand washing, hand sanitizing. Hand sanitize before an activity, hand sanitize after. And it works. The data is pretty clear. And then on the other end is that, workplaces have been going on since the beginning of this. And those of us who work in hospitals, it's just now part of how we do our business and how we work, and it's safe. Yeah, we have cases every now and then in our healthcare workers. The vast majority of them are acquired in family beach vacations or in activities outside the workplace, and the number of people actually affected from patients has been really small comparatively, a handful. So, and that's in a hospital where there's coronavirus. So, and then we look at all of the workplaces that keep going because they have to. Yeah, they've had cases; they get small clusters, but they get mitigated. We deal with it, and it goes on. And it's. For the most part, we've been able to keep going and doing what we're doing. But you have to do so in a measured way, in a responsible way, and if you have questions on how best to go about doing things in a workplace or a school, is ask people, get some expert opinion, because a few simple things can really reduce the risk down to an entirely acceptable level. And I really would like to have more of a measured middle, let's get through this together approach to this. So with that, I'm going to go ahead and go through some questions that we were given. The first one, we got a bunch of questions last week, and it came in kind of late, but it was the hot topic of the day regarding hydroxychloroquine, the medicine that people putatively would like to use for coronavirus. Well, so hydroxychloroquine is kind of like your cousin Eddie who drives his RV and parks in the parking lot in front of your house and is supposed to stay for 2 days and just won't go away. Because I thought we settled the hydroxychloroquine questions a month and a half ago. And the randomized control trials, and there's been 5 now, show it doesn't work. for COVID, and that there are some signals actually that there may be some problems, particularly heart, for small numbers of people who take it. It also doesn't prevent COVID, so it really has no role. It's a good drug for malaria. It's a good drug for some people who have lupus because of its anti-inflammatory activities, for some people with some arthritides. But it is not a good drug for COVID. And I wish Cousin Eddie would take his RV and go home. We just don't need to talk about it anymore. Thomas asked, some studies have indicated the likelihood of transmission in children was relatively lower than adults. However, a recent study showed younger children carry relatively higher loads. Can you address the differences in these studies, as many families are trying to make child care and school decisions? So I'd love to. The predominance of studies shows that transmission is lower in children, and the younger the age, the less the transmission. And as the kids get older and closer to being adults, transmission becomes more like adults. And I'd say putting together the probably 40 to 50 studies that have been done now, that's what they show. In households, children can transmit and do transmit, but the risk is for the younger ones a lot lower than adults. But you have to understand that's in a household where people live together and are live in close proximity, and household transmission is the highest risk for COVID. 85% of the cases that have occurred across the world have been in households or very close family clusters. But the viral load in kids may be roughly about the same. That was a small study that was published in JAMA Pediatrics, I believe, a week or two ago. Small number of kids, but that's what it showed. Why would that be? Well, there's a lot of speculation that one reason may be kids move less air. Lungs are smaller, so there's not as much viral particles coming out with each breath. And that kids are less likely outside of the household to be close to other people and doing things where transmission occurs. We've seen no super spreader events from children, but we have seen them in adults. And we said last week, 20% of people probably transmit 80% of COVID. So yeah, there is less transmission. But there's something about kids we're still figuring out that makes their risk lower, probably at least 50% lower if under 10 in age. Any tips on, this is from a lot of kindergarten and high school teachers, any tips on protecting teachers and children? Can anything else be done in addition to wearing a mask and shield, hand washing, social distancing as much as possible, will return safely home each day? Those are the big things, and that's masking, personal distancing, and very good hand hygiene. So one of the things that we do in healthcare that would be a great tip for people who work in schools is wash in, wash out. And what does that mean? That means do hand sanitizing or wash your hands before an activity or after an activity. And it just kind of becomes part of your habit. So when you go in the room, hand sanitize. When you leave the room, hand sanitize. When you start an activity with your children, hand sanitize. When you end it, hand sanitize. Go to the bathroom, hand sanitize. Get out of the bathroom, hand sanitize. Before you eat, after you eat. If for some reason you're going to touch a child or need to touch, because it's going to happen, and that's okay. Hand sanitize before and hand sanitize afterwards. And this is the way that sports teams have been doing it, and athletes, and it really makes sense. And once you get into the habit, it helps. And some teachers have asked me, should I change my clothes when I go home? In healthcare, we used to be doing that. We're not so much anymore. Clothing just really hasn't worked out to be as big of a transmission risk as one might think. The big thing is the breathing and the hands, so mask and then hand hygiene. And then shoes aren't a problem. That's been studied. They really don't transmit, probably because we walk on our shoes, and so anything you might have stepped on gets rubbed off before you get anywhere. You know, are there any vitamins to take to boost the immune system? Well, you know, there's probably nothing better to boost your immune system than getting good rest and eating well, good nutrition. You know, it's stuff Mom told us to do growing up. And so that's probably the best. Vitamins don't hurt. Some people need more vitamins, particularly women, anyone who's pregnant. But otherwise, they're a supplement, but not necessary. So Mira asks, my husband had a massive stroke, and we need to have people in our home to help him. He's 83 and very vulnerable. Any suggestions on how to keep him protected, since we don't always know where the people have been in our home? This is a great question. And first, I'm really sorry to hear about you know, what happened. And I want people to know that when you have people in your home that you're caring for, either elderly or somebody who has health problems, that you're not alone. I mean, there are a lot of people in this situation. And yes, people come to the home, and you need them. They bring oxygen, they bring medicines, they bring food, they bring help, visiting nurses and such. So what can you do? Well, first of all, you know, these people should be masked when they enter the home. They should have performed hand hygiene, certainly before touching anyone. And if they're touching people, you know, in a healthcare sort of way, they should be wearing gloves. And you can ask them, have you performed hand hygiene? Have you washed your hands? You know, me as a doctor, if a patient asks me that, it does not insult me in the least bit. What it means to me is that they're engaged in their loved one's care. And I think that's really cool. So you can ask. And then have some hand sanitizer available in the home so they can use it. Most people, we got the mask stuff down now. People who are in a healthcare providing role, you know, like visiting nurses, should be actually wearing hospital grade masks rather than cloth masks. You know, I think that's a really good start with that. Most of the home health agencies and most of the visiting nurses, you know, are very professional and are doing what they're supposed to do. But it's okay to ask and ask about these things. You can ask them, you know, what is your company policy about, you know, safety with COVID and things like that. It's okay to do that. Here's a great question from Miriam. Can COVID-19 be the switch to turn on diseases such as leukemia or autoimmune diseases such as type 1 diabetes? What a great question for an infectious disease doctor who likes academic medicine, because yeah, there are viruses that are associated with some cancers. The viruses that are associated with cancers tend to be ones, though, whether it's more than 10, they are ones that are persistent, and that they actually integrate with your own DNA. And then cause cells to multiply abnormally. And these viruses are pretty well known to us in medicine. And the kind of cancers they cause are pretty well known. You know, it doesn't really seem that that's going to be a problem for SARS-CoV-2, the virus that causes COVID, at least as far as cancer goes, because the virus doesn't persist in our own cells. The virus really doesn't last all that long in people. Few days, and then we have to deal with the repair and the inflammation afterwards. So I don't think we're going to see that with SARS-CoV-2. We see some some things that happen after the virus that are associated with inflammation and an immune response, but not, I don't think we're going to see as cancer. And then specifically about type 1 diabetes. So there has been, over the last 60 years, some thoughts that there are some viruses that people might get that cause an immune response that then attacks the cells in our body that produce insulin. Most of these viruses are anaeroviruses. And we haven't seen that yet with SARS-CoV-2 as far as a relationship with diabetes. I think it'll take more time for us to know for sure, probably a few years to see if there's a relationship. But so far we haven't seen that. But there are post-COVID inflammatory conditions, including myocarditis and inflammation in the heart, and then some in the lung that we've been seeing. But diabetes, I don't think has popped up yet. Carol asks, what is the best defense for a diabetic? I know keeping your sugar down, but any other tips to make sure our immune system can better fight if we get it? So no, it's basically all the other things that you've been told to do to stay healthy as a diabetic is the same things through COVID. Certainly, trying to avoid getting COVID is a good idea. And so if you're a diabetic, take the precautions with that. But otherwise, it's everything that you normally would do. Debbie asks, does the virus live on surfaces? If so, for how long? And does it live on some surfaces longer than others? What is the chance of contracting COVID from surface contamination versus from droplets in the air? So, well, yeah, it can live on surfaces, and we know that if you swab surfaces and you look for it, and somebody with COVID has been near there, that you can find, at least you can find the messenger RNA. And sometimes you can find viral or replication-competent viruses, which means a virus that can be transmitted to somebody. It turns out the smooth, shiny metal surfaces, it can last on longer than others. So the ones that, so stainless steel and so on, the shiny, smooth ones. And there, maybe it can last around, a little bit more than 24 hours. Paper, cloth, things like that, upholstery, it doesn't last as long on. So if you're getting on an airplane and you want to disinfect, and you brought your wipes to do so, get the shiny surfaces, the tray table, the armrests, the seat belt. And so on. I'm not sure you need to do the fabric itself. There's a few things, obviously, that'll decrease that, the virus on surface. Disinfectants, just plain old soap and water is 100% effective. So washing things, disinfecting it. 10% bleach spray on a surface works great. So if you can't find the bleach wipes at the supermarket, which I'm betting you can't, you can make your own in a spray bottle. 10% is what you would use. And UV light. Great study this week about just sunlight. In an hour, virus is dead. So those things will decrease it on surfaces. Our epidemiology now suggests that most people get COVID from other people through the respiratory droplets or directly touching them or being near them, rather than getting it from a surface. That seems to be a more minor component. So, how safe is it to stay in a hotel? Do portable UV sanitizers help? Well, staying in a hotel, once you get up in the room and you're by yourself, it's pretty safe. And it's the waiting in the line in the lobby, waiting for a cab, waiting in the breakfast line, and those that have the free breakfasts. Those are the places where you're close contact with other people, and the more people you run into, the closer you are to them. And certainly if people aren't masked, that increases the risk. So, you know, maybe skip the free hotel breakfast if it's down there, and grab takeout from or you know, from a takeout window, drive up or something like that. Do portable UV sanitizers help? Boy, you know, you get what you pay for those. We're trying to figure out in hospital settings, do they work? In the lab, they work. They kill COVID. I don't know about the portable ones really. I'd probably hold off until there's some better studies rather than just the manufacturer's exuberance on a sheet. Because if the UV light doesn't shine on something, it won't kill the virus. So it doesn't go around corners and things. Suzanne asked, can I participate in the vaccine testing and still donate blood? Well, this was a good stump the chump question, because I didn't know the answer. So I asked a few people who do know, our clinical microbiologists, who also runs our blood banking and works with the Red Cross, and then John Sanders, who works with vaccine trials, and looks like we'll be working with SARS-CoV-2 COVID vaccines trials here in the area. So the answer is 12-month deferral from date of receipt of vaccine. So for a year, you can't donate blood. You almost stumped the chump. Not quite. So 12 months. Great question. Thank you for that. Diane asked, to what extent does wearing a mask under the nose reduce its effectiveness? Considerably. Yeah, the nose and the mouth need to be covered. Anything where air comes through. Also, the masks that have an exhale valve so that your breath goes out, those reduce the effectiveness considerably also. So exhale valves, I would try to avoid these when you get your mask. Wesley asked, does a person's blood type affect their chance of contracting the virus? Maybe. There's been some looking at this, and you know, it turns out there's a lot about us and the differences between us as individuals that affect our ability to contract all sorts of different infectious diseases, and you know, it's sort of our hereditary and what makes us up. And the blood type is just one of those things. There are other antigen differences, something we call HLA might affect it, and some other areas. So we're working some of that through, but those take large studies and it takes some time to prove it. But it wouldn't surprise me because it is for other infections, and there's a lot of infectious diseases that affect certain ethnicities more than others, and so on and so forth. So it wouldn't surprise me. I think there's probably something to that. Helen asked, do you think there are various strains of the virus and that our community may have a less mortal strain than Italy or New York City? Well, there are different strains. We call them clades in the world of virology, and there are small differences in them. But to date, it doesn't seem there's really much difference in virulence. What's virulence? It's the meanness of the virus and how effective it is to transmit or cause disease. So they seem, all the clades seem to be fairly similar with that. So I would really doubt that our local clade is any different in its ability to cause infection and its severity of infection. So that wraps up today's questions. I was asked to wrap up on a positive note for some words of encouragement. So, you know, we're six and a half months, almost 7 months now into this, and looking back, yeah, there are things we could have done better as a nation, as a state, even as a local region. There always are in these things, and you know, I think it's rather than trying to beat ourselves up about why we are where we are compared to other places, it's best to just think ahead and know what works. And if everyone really got together and did the simple things we talk about, masking, personal distancing, avoiding large crowds, and being wise about our movements and what we're doing right now, our numbers will come down. including through the fall. Some other encouraging news, all these things that we do to help prevent COVID are also going to help prevent flu. But there is one thing you can do for flu. Go get your flu shot. They'll all be here soon. It's almost flu shot season, so make sure you get your flu shot this year. And then I think once we get through the winter and our viral seasons, I think things are going to be better. And I suspect we're going to be, at this time next year, we're going to be in the middle of trying to get people vaccinated because the vaccine trials are going forward and are encouraging. So, we're going to get through this. And I don't really have any doubt about that at all. So I slept very well last night. So with that, I'll see you next week.